Sure. So the idea from this project started when I was a therapist with the multiple sclerosis clinic, and we introduced an electronic medical record into that clinic so that all of the doctors, all of the therapists, were going to input information into the record as they were interviewing or assessing the clients. And then that way it was readily accessible to anyone who was involved in the clinic. So basically, as I was working with clients and working on trying to become skilled at interviewing them and using the computer at the same time, I was concerned that perhaps it might be influencing the therapeutic relationship. I was wondering if it was a wise idea to use a computer in the initial interview while I'm trying to establish a therapeutic relationship. And so I thought that would be a great project for our Masters of OT Independent Study projects. And so I had Ashley Orr, who's here with me, and Ali Nori work on that project.
So Ali and I performed a literature review, and we found that a lot of the articles looked at computers and physicians, but there weren't any that looked at occupational therapists. So we gathered and collated this information, and based on the literature review, we found that a lot of attending behaviors such as eye contact actually decreased when computers were introduced. However, clients were still satisfied with the overall interaction in the therapeutic relationship. We then decided that we would like to look at this further with occupational therapists, as there might be some new information that comes up, and the interaction with physicians and clients may be different than with occupational therapists and clients. So we had Melissa Nance, who is an occupational therapist at Health Sciences Center, be our study therapist, and she used paper documentation for some clients and computer for others. Our results mimicked the literature review, so clients were still overall satisfied with the therapeutic relationship, whether Melissa was using computer documentation or paper documentation. And unfortunately, our sample was not robust enough to be conclusive. So preliminary results suggest that introducing the electronic medical record is not going to significantly affect the clinician-client relationship.
One thing that we learned from this project is that there's a recommended way to have the environment set up when you're using a computer to input information while the client is there, and that's to have the computer to have the client sitting beside your desk rather than right across from you. And that way you've created a triangle between the computer, yourself, and the client, so that you can think of the computer as being a part of that interaction rather than it being the therapist and the computer and the client sitting separately. So you want to open that up. The second thing that I think is important is that we learn that people really do value the use of electronic medical records, and so we should really welcome it into practice instead of being afraid of it, and to use that kind of to your advantage. You want to turn the screen towards the client at different times if that's appropriate, to kind of show them what you're doing, get them involved in what's going on there. Another thing, as occupational therapists, we have this great toolbox of attending behaviors and communication skills, and all that becomes especially important to remember when you are using the computer in the room. So you want to make sure you're maintaining that eye contact, looking at the client when they're talking to you instead of looking at the computer screen, using your evocative empathy. All those things are really important in helping the client to build that therapeutic relationship. And finally, it's important that you feel comfortable with the computer and that you're skilled with the computer. So you want to make sure that your typing skills are up to par. You want to make sure you're comfortable with the software. If you're in the middle of an interaction and things aren't going well with the computer, you just want to push the computer aside and then focus on your client, because that's what's most important in the room at that time is the client, not the computer.
On our literature review and on our independent study, we created some electronic medical record best practice tips, and we're going to share them with you now. So first is to turn and face the client each time you speak rather than looking at the computer screen. Be conscious of screen gazing. Attend to the client after each time you use the electronic medical record. Overall, healthcare providers can maintain connection with their clients when using the electronic medical record by making an effort to make eye contact throughout the interview and by turning their body to face the client when not using the computer. Set up the room so the client is seated to the side of the healthcare provider's desk. This setup ensures that the computer screen does not block the line of vision between the client and the healthcare provider. In addition, the healthcare provider requires only slight postural adjustments when turning their attention to the electronic medical record and then back to the client. Flat screen monitors with mobile arms should be used to periodically turn the screen towards the client. This gives healthcare practitioners the opportunity to engage clients with the computer, which increases client satisfaction with the encounter with their healthcare practitioner. It may be also helpful to use swivel chairs so that you can easily transition between facing the client and the computer. Healthcare providers with excellent computer skills are better able to simultaneously use the electronic medical record and talk with their clients. Finally, it may take 8 months to 1 year for a healthcare provider to become confident and competent using the electronic medical record.